All right, Amanda, thank you so much for making the time to have a conversation with me. I've been fired up all week about this chat for a multitude of reasons. One, because I'm such a big fan of your work and your thought leadership and the global perspective that you bring to issues, COVID and then some. And also because I think you have such a unique vantage point on this as 30 plus years in the medical world, in academia, and also just as such an established director, businesswoman, Telstra Businesswoman Award winner yourself. I'm interested because I feel like in a lot of this COVID conversation, I want him to get into some of your reflections on what's taken place in the last couple of months before we cast forward. I feel like we've been trapped in this little bit of a binary, false binary that some of our world leaders have thrown us into, that it's either health or economics. Pick a side, choose your lane, and back it to the hilt. And I'm interested to get your reflections on where the conversation and where leadership's been on this issue before we think about how we can do a bit better.
Well, thanks, Holly. Well, thanks for the opportunity to talk to you. I mean, I always love your energy and your passion, your vibrancy and your thought leadership. It is interesting, isn't it? And to your binary point, I don't think it is a binary because, you know, that they're absolutely connected. But there are lessons in both, aren't there? And there are lessons in both for us. If I take the positive things out of COVID, and I'm going there first on purpose, because, you know, who would have thought all of the world, every person in the world would learn about public health. It's like the biggest public health campaign that no one would ever spend money on. So what it's done is it's taught the world about what is that? What is it that people weren't interested in that before, but now they understand it. So they understand, oh, I get it. This is about health for all. This is about my health, my loved one's health, my family's health, my workers' health, my community's health. And then the global is you take the circle out. Mm-hmm. So if we think about that, well, that's great. And we also understand hygiene, and we also understand infection, bugs, flus, all of that. So you're going, okay, we've now got a given. We've run the giant campaign. Everyone's across it and understands it. And they also, more importantly, understand it from the lens of how this actually directly affects me, rather than saying, well, that's not really relevant because I'm not in that group, that demographic, that geography. Mm-hmm. So leveraging that benefit, then to say, okay, well, if we know all of that and we've got the learnings out of that, how do we want to leverage that in the new world that we're going to, the new reality? You call it the new normal, whatever it might be. And typically you would say to business, well, business doesn't really have a role in health. You know, they might have a healthy snack Friday. If you said, look, you're really pivotal in health, they would say, no, we're not. We run a business. We have a tight cost. We have, you know, we run profits. We're highly capitalistic. And you go, well, actually, you have a major role in health, and you have a major role therefore in public health and society, good for society. So if we take these convergence, we can actually say it's not an either or, it's a both and we can manage risk and opportunity, and then think new emerging markets, new ways of working, new ways of living. So would you, you know, if you were living in the middle of central London in a tiny apartment and you were going to do all your remote working forever because your work world had changed, would you stay living in your apartment in the centre of London, or would you say, well, maybe I might make a choice to move to the Cotswolds and work from there in a bigger, you know, whatever it might be. So all of these choices are going to come about where we live, where we work, how we work, and change the norms about how we practice that work. And then, of course, leadership as a whole will come to that in a bit.
Yeah, so, to ask you, you know, in terms of, I think it's really interesting, one of the things you touched on there was sort of the responsibility now that businesses are starting to think about from a health standpoint. You know, you're someone that's a big believer in shared value and purpose and not purpose washing. Let's be clear. We'll get into that as well. But I'm interested for how you think it's going to change the demands on that aspect of our conversation, you know, because I feel like for a few years now, you know, the CSR notion of just writing the check to the charity at the end of the year and things like that, the bar started to raise. Consumers are expecting more. Employees are expecting more. The community are expecting more. How do you think that that's going to transform in a post-COVID world order?
And investors are expecting more.
Good point.
To your analogy.
Yeah.
So what I think is going to change is the questions that are going to be asked are going to be different.
Okay.
So we typically, if we look about ESG, environmental, social governance, and those non-financial metrics of companies, what do you do beyond the financial business of your company in that lens? And there's a lot of metrics and work done, and increasingly so investment in ESG sort of orientated enterprises. So what if we change some of the questions? And what if the questions came, instead of being, well, tell us about your supply chain and your labour practices and your diversity policies and all of that, which is already sort of embedded. What if the conversation started to change with a health lens and said, well, tell us about how you treat your people. Tell us about the health and well-being of your people. Tell us about how you use health and well-being and how you consider things in your supply chain, in your procurement, in the community in which you operate. In the
I find that quite fascinating listening to it, because I'm imagining if you threw that question at most leaders right now, they wouldn't be able to articulate an answer to you, or a substantiated answer.
No, but it will make, but I think what the great thing about COVID though, they will absolutely be able to articulate much more of an answer than they could pre-COVID, because pre-COVID they would have gone, well, no, we've got Mary, she works on Friday, we've got a healthy snack program and a steps thing, you know, we've got a line item under, you know,
triathlon once a year,
etc. So they think that they're doing well because they don't know what they don't know. But I do think now modern leaders will actually step up and realise that all of a sudden it's so much more critical to look after our people, and we have such an obligation both from a legal perspective and a moral compass perspective, and also from a reputation and talent management. So people will want to go and work in those companies that treat their people well. Now you could say, well, I've always wanted to do that. I'd always prefer to work for someone who's, you know, purpose-driven. But I think now it'll be much more discerning and deliberate by, you know, millennials and other people coming up to look for work. They're going to choose their leaders and choose their enterprises and companies based on how people behave. And an example of that is, even if you go back to like the story of Walmart, you know, you probably studied some of this when you were in your Harvard studies, Holly, you may have done it as a case study. But Walmart, you know, big box retailer, but when Hurricane Katrina happened, and they didn't have a great reputation before Katrina. But what happened with Katrina is the leadership said, oh my goodness, threw their hands up and said to all of their leaders and all of their sort of subcategories, go forth and do whatever you think you need to do. Logistics, give out supplies, partner with a charity, give your people volunteering time, everything. And so they really devolved this leadership and just said, we'll work it out later. You decide, don't have to get the memo, go forth and do. And so they did. They went forth and made incredible impacts. Now that behaviour did so much for their reputation, their stock market price, and now Walmart took it further in things that they do. And that's an example of leaders being agile enough to say, these are different times.
Yeah, really adaptive.
And so now, these are different times, aren't they? So now we've got leaders going, well, there's the crisis management piece. Yeah, we're pretty well all trying to do that. There's the cash piece. We've got to maintain cash and, you know, viability and solvency. So it's all the sort of critical urgency pieces. And we have to keep our people safe, because if we don't, we work for lots of reasons, but we've got to keep our people safe. So people have sort of started with those principles first, you know, cash, safety of people, and then reshaping the enterprise. And then now I think there's now this movement of called this, so what now? So what now? So now we've got a sense of the degree of COVID that sits in Australia, the degree of COVID that's sitting in the cities around the world, where's our business, and then starting to think about whether we pivot, all those sorts of things, and they're big conversations. But the principles of the leadership, no matter the enterprise, will be the same. They will be caring culture, no purpose washing, no greenwashing, and no health washing. They're my three washes.
So for those who aren't familiar with that term, explain what you mean.
Okay, so if we say, well, we know greenwashing. So greenwashing is the token environmental, yeah, no, we're very good, we do that, we've got
once a year.
Wooden straws, but then there's a whole bunch of other stuff that's not authentic. And then health washing is similar, you know, yeah, we say that we do all these wonderful things around health, and in fact, we do the opposite, or it's not authentic. It's all about authenticity, isn't it? And then purpose washing, to your point, it's the same thing. yeah, we're a purpose-driven company. Well, let's just unpack that. And what are your statements, and what do you mean by that? And purpose-driven really means to be shared value, doesn't it? It's not about what's the purpose. I exist to sell widgets over in this geography. The purpose is I exist to make this particular business, but for a greater good beyond our four walls and beyond the edges of our enterprise, if you like. So that just goes to authentic leadership, doesn't it? So things like, Bill George's work on True North is amazing. Rebecca Henderson's work on reimagining capitalism. All of those things are about the principles of being a leader will really almost be the same, but they're going to have a different lens, because the lens of health and well-being will be far stronger for every leader. It will have to be. It will have to be. And it'll have to be at the strategy C-suite board level, not at the subset of the CSR line in the P&L by one person with that badge. It has to be across as a strategy. And those companies that do that well, that consider health in their business, employees, what do we do for our people, supply chain, how do we consider health and well-being in the supply chain in a new way? How do we consider the environment? And this absolutely goes to the workplace. Where are we going to put our people? Is it going to be remote? Is it going to be hybrid? Is it going to be half at home, half at work? Is it going to be a commute? Who don't want to commute? What is it all going to look like? But I have to, as a leader, have a health and well-being lens of that whole picture. I can't just have an economic lens or a health lens. I've got to have both. And then the last one is the health and well-being lens of my community in which we operate or where I sell my goods and services. And what we've seen play out, Holly, is if you look at all the sort of cases that are being written at the moment in the sort of online and by CEOs are going out and saying, yeah, no, we've given 1.5 million to food bank, and we've done this volunteering, and we've put up. All of these CEOs are coming out, and they're all spruiking, arguably quite rightly, the good things that they're doing during COVID and post-COVID. Now, what does that say? That says that they know the value of reputation and being authentic leaders. Now, the ones that don't do it fulsomely will get caught out as health washing, purpose washing, greenwashing. But the ones that have done it authentically with a strong moral compass will rise to the top. And there's a wonderful, you may have seen it in America, the Just Capital's COVID tracker.
Yep.
Walmart's, listed high on that, Microsoft's another a bunch of companies. But what they've done is they've tracked all of the corporate responses by type, by category, about have they adjusted their hours, have they given furloughs that are paid, have they changed their spaces, have they done community service? And there's a very nice set of graphs, with a great objective data. And I imagine companies are going to really want to be in that place where they can say, I'm in there and I've done all this, or we have done all of these things. So it's definitely this intersection, and it'll be caring culture, moral compass, tight business rules, of course. No one's taking that away. Shareholder value, but not shareholder primacy. Stakeholder.
One of the things that's interesting to your point around even the tracker is because this phenomenon is global, and while it is impacting businesses in different ways and countries in different ways and you name it, there is a universality to it, which makes the comparability of how companies and leaders are responding. It does feel, even the way they've got league tables, it's interesting because now you can't argue, oh yeah, but they're in a totally different world order. They're dealing with a totally different phenomenon. There's a degree to which it's like, hold on, we can actually hold the same feet to the same fire now, or the different feet to the same fire, I should say. And that's prompting a new, I think, accountability around some of the things you're touching on.
And I think then if you take that further with the investors, and we'll see this over time, how this plays out. But I think the investors are going to look at all this information now. They're going to look at the broader information out there about sentiment, company sentiment, about what they do, because all of these factors will be factors to consider in, is this a company I want to invest in, whether it's part of a big fund or, smaller investors? Is it going to be here for the long term? What are the things that's going to keep it here for the long term? So that balance of the short-term, quick, fast money versus long-term gain, long-term sustainability. And we know that, people like George Serafine from HBS has done amazing work absolutely showing the true association between those who do sustainability well in their company outperform on stock market price and performance. So it's not a nice to have CSR line. It's a credible, tangible benefit to the shareholder and stakeholders.
Yep.
And if we think about where was environment? A few decades ago, the environment was, well, a bunch of people doing some good things for the planet, but, that was the environmental movement. And look how that has just, if you don't have an environmental policy seriously as part of your strategy, you're just way behind now. I mean, it's normative, isn't it? It's normative environmental thinking in any enterprise. So I really believe that health and well-being is the next environment that's coming. It's the next big thing. It has to be. It's arguably the biggest thing, and we've seen it play out, that's going to shape us in terms of people, purpose, planet going forward.
Mm-hmm.
And if we treat it like the new environment, what lessons can we take from the environmental movement about how that changed the way we think and behave? Because there are good lessons there. And then think, okay, well, instead of having health in ESG, environmental social governance, oh yeah, there's some little health things under S. Yeah, no, absenteeism. And it's this, these little, and it's work health and safety. Yeah, got it. Yeah. But it's elevating this H in business so that it's a hero.
Mm-hmm.
It's not a subset.
I love that. There's so many threads I want to pick up on there. But the first one being, if companies are thinking about it, how to do exactly that. So to make health front and center of how their business operates, to position it as a hero in the way that their organizational culture works. What are a couple of key points or priorities you'd say these are conversations you need to be having, or these are key pillars of what you need to be doing?
I would, well, you can break it down. You'd start with your 4 pillars to make that easy for people to understand. So what is it in the employer lens and the people lens? And people, it's an easier place to start because people sort of get that, don't they? So what else can we do for our employees in terms of considering their health and well-being? Now, it might be access, it might be support, it's our EAPs, it's our all sorts of access to credible sources of information, it's all the stuff around COVID. There's a whole bunch of stuff with the employees, maybe working from home, considering their families, all of that. The next one is supply chain. So how do we think about health and well-being in the supply chain? Yep. So what if we were to change our procurement practices based on with a health and well-being lens? What would the questions that we would ask of company A or company B in a criteria piece that would not just price, obviously price is one, we don't want to have slave labor, we don't want to have discrimination, all those things. But what if we considered, how might we consider that? So you would define that for your business.
New criteria for thinking about tender processes and the like.
Correct. Any procurement. Yeah. So tender. So I want to purchase from A and B. Yep. You've got, here's all the procurement guidelines. Here's the tender process. We weight things based on ABC. What if we had a weighting that was around health and wellbeing weighting, and we ask questions of others? Now, at the moment, they would go, "Oh, hang on a sec. We don't normally have to tell you about that. That's not part of our normal procurement." But what if it was? And that's where I think that's a shift. Then the next one is around the environment. So where do we put our people? I don't mean environmental so much in terms of green sustainability. I mean the physical environment and the environment in which we operate. Yep. So that would be all the things around post-COVID world. Where do we think people are going to live? Are they going to want to commute? Are they want to be on public transport? No, they're not. Are they going to ride their e-bike to work? Are we going to offer some bikes? Are we going to What could we do in a different way to put a health and wellbeing lens around the environment? Now, we know there's going to be hand sanitizer and 1.5 and desks apart and 3 people in the kitchen. But beyond that, what else is there about how these people work? And there'll be some interesting data that will come out about if you looked at, for example, if you took healthcare claims pre-COVID of a particular company, and then you looked at them post-COVID and they've all been working from home and they haven't had to commute, they've had some more time with their families, they haven't had the 2-hour stress of travelling on the plane to go to the country. What are the health and wellbeing benefits that have come out of that? There'll be some negatives on mental health, there'll be some real positives around, God, I don't have to get on the train and I don't have to travel and I can see my family. So that will be data that will inform, to your point, going back to it, that will inform the environmental piece. And then the last one is community. So we can make a decision in our toolkit of what we're going to do, how we consider a health and wellbeing lens in the community in which we operate. And it may be to do with volunteering. It may be an added CSR lens, but it might also be we're an anchor institution in this city. We actually, we employ a huge number of people here. We're pivotal to this community. What else can we do for the community beyond the typical, sponsor the fun run or whatever it might have been? So it's taking those 4 pillars and this is what I'm trying to help companies do at the minute, going deeper dive in there to say, here's some pragmatic things that you can do. And when you add them up as a collective, and they're not all costs, they're behaviours and actions and collaboratives with your people. They're not always just, 10 more cost items to give us that health and wellbeing lens.
Yep. One of the things that strikes me is pulling together a couple of the threads of things you've shared. I find it interesting in conversations with leaders at the moment. There's sort of 2 categories. There's one who believe that this is fundamentally changing the world order. Is going to be, and one of the most overused phrases I think we're entering into our vocab already is this phrase around new normal. And so there's that category who are convinced. And then there's a category who I think is still looking forward to being able to pull us back to traditional practices, who think that working from home is fundamentally just not capable of ever being productive. And so, we'll ride this out, but then we'll have everyone physically working again and all these sorts of things. So there's sort of a surge mentality of some that I think are like, okay, we're adapting for the here and now, but then we're going to return to old habits.
Can't wait to go back.
Yeah, and it struck me when you were talking about the Walmart example before, that one of the things that's challenging sometimes, particularly when we're in situations where there's there's an immediate stressor, be it the hurricane right the way through to a COVID type of systemic challenge. It's not necessarily a mindset where we naturally go, let's innovate. Let's take the hierarchy out of our leadership structure. Let's adapt new work practices. What advice have you got for leaders that are either challenged themselves or are noticing a challenge in their leadership culture around them to want to revert to old ways, to resist innovation, to kind of cut or restrict versus think expansively?
I've got a phrase that was actually a phrase of my father's that I use a lot, and that is, don't debate the forecast, debate the assumptions.
I like that from Dad.
Yeah. So if it is true, if you believe, hopefully there'll be a vaccine, we're going to get through this, a lot of pain, and then 1st of January 2021, it's all going to go back to how we were. So that's
like something I heard in a US press conference the other day, by the way.
There you go. Well, you're saying that on the basis of a bunch of assumptions. You're saying that on the basis we were really high performers before, we're fantastic, we had a high profit, we had happy people, and everything was hunky-dory, and of course we want to go back to how the world was. Well, 2 things. One is really critically look at your assumptions there, because actually, have you really critically looked at what's been happening in these last few months? Because you may well find that in the assumptions are, actually, if I critically look at this, in fact, my people have been happier. They were a bit, thrown at the start, but in fact, we've seen some productive teams, we've seen some agility, we have seen some innovation, we've actually reduced our cost of travel, we're not paying for the accommodation, we've actually got some economic benefit actually, because we're not flying with people around the world. So all I would say is critically look at the assumptions before you make the blanket go back to how it was.
One of the things I'm hearing from you too is get a little bit more nuanced. Like, it's not just bad or good, there's shade in this.
Yeah, there's shade, that's right. And there's pick and pack.
Yes.
Let's pick and pack this. And let's pick and pack this first. And let's be first to move out and move forward. Because what if it was that you looked at your people and you said, instead of saying, well, we're going to have an A team and a B team going forward, well, look at that critically. Is that right for what you're trying to do? Is there another way? What are the assumptions around that? What do your people think? So I think there is some time being bought where strategically, and this is what I'm helping a couple of companies do now, to think this through in a way that looks at those nuances and looks at those assumptions. And you might even find, for even simple survey data that you could do on the fly, even stop, start, keep, fix things, where you can get a real snapshot of those assumptions testing without having to, do a really randomized control trial, to give you a sense of that. And I'm so surprised by companies that would think we've got to go back to how it was, because it won't be how it was. It won't. And even if there's a vaccine by the 1st of January next year, the new world of thinking about pandemics and other, it's changed. And I'm not so keen on the new normal either.
No.
I quite like the new reality.
I
But
don't know what
in any
normal
event, it is going to be different.
Yeah, completely. Now,
Yeah.
I've seen in some of your writing and some of the conversations that you've been leading since COVID's descended on us, you've been talking about now's the time. What is now the time for? What do we need to be doing?
Well, that's the thing. I talk about now's the time, don't wait for the memo.
Yep.
So it's just about thinking differently. And the simple way to do it is to take the lesson that we have just had, this global lesson in public health that has shaken us to the core because it's been so personal to me, my family, my loved ones, and my workers at the same time. Take the lessons from how we've felt with that and how we've had to behave in that and elevate it into your strategy and your thinking and your leadership in your company and enterprise. That's the first piece. Take all of that feeling. It's not just a little thing that happened over here and we'll just park it. It's, haven't we seen? This is all encompassing. What really matters? What are the things that matter? Well, our families matter. Our health matters. What if our worker colleague died? What if our loved one died? What if I died? Think about this seriously. There's nothing more serious. So if there's nothing more serious, then it must be elevated to think of health and wellbeing in a different way, in a new lens, but use it as an opportunity to go, okay, what can we do here with our people and where they want to work, how they want to work, how they can add value, and how we add shared value to the community. Because there's no doubt we have to build a resilient society, a more inclusive society, because what the pandemic has shown is that the inequalities are huge, and they were shown up to an even massive degree with COVID. If I take one state in America, 40% coloured people of colour, 40% population, representing 72% of the deaths from COVID, and 50%.
What are we talking about there?
I'm not going to share that at the minute,
okay.
just because it was shared with me privately. But it was, you would know that it's one of the states with high social disadvantage.
Yep.
And what that's meant is 72% deaths and 56% in the cases, despite being only 40% of the population. So and it's comorbidities and it's social disadvantage and all of that that's caused that. But we as a society, we have to build our leadership and our new enterprises and our new way of working, and we have to have a lens to the community and society more broadly, and we can do it in a shared value way. So people win, everyone wins.
Well, you're talking a little bit there about the carrot side of things, so the incentive for new opportunity. Let's elevate. Let's lead this off our own bat. The other thing you made me think about when you were talking there was just the stick side, which is how, for example, from a corporate governance standpoint, occupational health and safety fundamentals are going to change, and the bar that we're going to hold organisations to out the other side of this, when we think about what is the new baseline, what is the new set of expectations, 5-10 years is going to look fundamentally different to where it is right now. So it's interesting, those two things.
Yeah, that's very true. And that's another reason why you can't go back. You can't go back, because even if you just take work health and safety, take that. Yep. So that's not going to let you go back to how it was. And it's not just because of the vaccine. Rules are going to change about how people engage, and notwithstanding the social thing about don't come to work sick. Your colleagues are all going to pounce on you. Well, they won't touch you, but they'll push you.
Yeah, they'll socially distantly
say, "Can you go home?" Don't come in. So, but I think it's exciting too, because it's a shake up, it's a wake up, it's a we're all on the same page, we're all in this together, all those cliches, but in fact it's true. Everybody understands public health. I had a world of running an intensive care unit for 10 years. I worked in critical care nursing to start with, and people would say, and did a lot of complex intensive care things, and people would say, oh yeah, so they had no concept of what we did. But now the whole world knows about intensive care. They know how complex it is, and they know how sad it can be and how tragic it can be, but also how wonderful it is if it saves lives, etc. So we can take all of these lessons of what we've all learned together. We don't have to re-explain it. We just lived it. So we now know the importance of public health, and this is absolutely the time where business and health comes together, almost without question, really.
I think we've also had an appreciation for teachers in a way that we probably hadn't before.
Well, I've just written a paper actually with a colleague from Harvard that's in press at the moment, and we talk about that, the heroes and heroines So they're all the new ones, because they used to be the frontline workers and the people in the logistics, the truck drive, they're now the frontline workers, the truck drivers, the nurses, the post people who deliver up food and drink, etc., and the people who are working behind the scenes, all on virtually low wage jobs that we didn't really regard so highly perhaps before. And nurses, even teachers, and all of a sudden, who are the new heroes and heroines? Well, it's all of them.
Completely. I saw a meme the other day that said, I've done a day of homeschooling and I think teachers should be paid $1 billion. And I think everyone would probably say the same thing about nurses and paramedics and doctors and, all these people that are working at the front line, to your point, and are putting themselves in harm's way to be able to allow society to function, to protect people.
Yeah. And they say the same, but they used to have the same thing about nurses. They'd sort of be quite dismissive about nursing until they need one.
Oh, yeah.
And then when they need one, it's like, hang on a sec. So all of those lessons are actually really positive, I think, going forward. And I think we've got great lessons out of it. And I think that Australia's been positioned well. But I think it's a global collective, isn't it? It's collaborations and how can we group in alliances and how can we, share knowledge and share leadership learnings. And I think it's positive.
Borrowing from your dad's inspiration, you talked about questioning or challenging assumptions. What's and I think that comes with questioning and asking the right questions. What's the question I haven't asked in this conversation? What's the question we're not asking more broadly that you think is really important, that is more a part of our conversation or the catalyst for our conversations?
I think it's about what's important and what's not. Mm-hmm. Maybe that's perhaps a philosophical thing, but what this has all taught us, I think, is to really reconsider and reset what's important and what's not, because life is fragile and it's all got a bit too close for everyone. It's not the distant thing happening over there in another country. We can't say, not our problem, right here. Mm-hmm. So I think that perhaps it's that piece about the reset of what's important and what's not. And if we think of that in a personal sense of behaviour, action, mm-hmm. and then we think, and that might feed into the circular economy, what we buy and what we purchase now, and how many things we have and how much kit we have and what do we do with our time? Perhaps we're with our friends more than we're going to do fancy things, whatever it is. So I think it's what's important, what's not, probably that lens, and then how we apply that to everything. How we have a moral compass, how we treat others, the caring culture. But then there's exciting opportunity too to be part of a resilient shared value world, really.
Yeah, and I think
I don't answer your question.
No, it absolutely does, and I think that's such great food for reflective thought. And one of the things COVID has given us, and I'm not saying this universally, because some people I think feel like they've never had less time with the demands that are placed on them in the current context. But there is a lot of prompt for reflection. Whether we've got the time for it is another thing, but I think there's a lot of people that are reevaluating choices, decisions, priorities, you name it. The final thing I wanted to ask you about, I think sometimes, particularly the scale of COVID, I think it can feel overwhelming. The scale of the challenge in your family, business, broader world, you name it. If you could encourage people, having shared what you've shared, the observation points that you've got around this issue, to go and do one thing tomorrow as a first step to kind of respond, take action, challenge the way they're calibrating things, what would you encourage people to go do?
If it was in the sort of business and working world, I would challenge them to sit down and think about their assumptions. Almost like you sit with a piece of paper and think through the assumptions that I make currently in my working world, and whether they still hold true. And do they hold true or not? Or if I don't really know, what else do I need to do to find out? The second piece I would say is credibility of source of information. We've all been so overwhelmed with every news feed, every online feed, every talk is about COVID. So I would say the other actionable thing is to take time to think about your credible source of information and try and sort of stay true to them. So for example, if we think of a really actionable one in Australia, it's going to be our departments of health and our local departments of health, because that's the rules as we know it. Mm-hmm. If we think about credible trackers, we know Johns Hopkins are the world leading data. They've done the data for COVID, go there. If you want data for COVID and graphs and things, go there. Oxford University have done an amazing tracker about what are all the government responses around the world. Amazing, you can find some information there if you want to find these things. The COVID tracker with Just Capital will give you some great insights around what are other businesses doing. Don't Google it. Go to the subset of the subset. So they're a credible source of
research for you, haven't they? Yeah.
Research for you. So you can go there and look at what others have done and then go, wow, we could do that. That's a good idea. I might take that. Oh, I didn't. And then that also then feeds into your assumptions and maybe how you might change and modify. So I would say tomorrow, think about your sources of information and then perhaps stay away from some of the others that just too much.
Overwhelm your world and feed and everything in between.
So what do I want is my feed of some data and some information. What do I need is my feed of the credible stuff that I have to know the rules, what I can and can't do tomorrow, etc. Because there's rules. And then where are those other sources that I can gain credible information? And then there's some fun things. You've got to have fun. So you've got to find some fun stuff.
Yeah.
And that's all sorts of different, I'm reading some great books, and I think I put you onto Rebecca's book on.
Yep, I've ordered it. I'm waiting for it to arrive.
And there's another wonderful one coming out by Sir Ronald Cohen for Impact, which will be fabulous too.
So he's one of the originators of impact investing out of the UK, yeah?
Yeah, so I'm fortunate enough to work on the Impact Weighted Accounts Initiative with George Serafine at HBS. And so Ronald chairs our global steering committee that I'm on. And that's all about how do you formally measure impact in a sort of an accounting way.
I also love it because I think most people, when you said find some things to do for fun, we're thinking you were talking about binging on Netflix, and you're talking about like adjusting standards to get more impact involved.
So someone will say you need to get out more, Amanda, but I do go to Kangaroo Island a lot. And,
kind of why you are such a gift and why I'm so grateful you spent the time that you have done today with me. Thank you so much, Amanda, for sharing so generously with your insights and perspective. And I think the big thing I'm taking away is, one, going back and challenging my assumptions and thinking about those 4 aspects of how do we elevate health across all the aspects of the way that we're working and the dimensions of our businesses. And I think that is great reflection for each and every one of us to say it can't return to the way that it was. This is a moment in time that needs to challenge where the primacy of health within all of our conversations and all of our prioritization, and what's the commitment we're going to make. And what are the beliefs that I need to really investigate whether they hold true for the forecast or the assumptions I've made in how I've set my strategy.
And how to avoid all that washing.
Yes, avoid all the washing. That's right. No purpose washing, no greenwashing. None of it. Thank you so much for your time.
Thank you, Holly. It's been a pleasure.